Hi, I am Dr. Patricia Lo. I am one of the obstetricians and gynecologists at Orange Coast Women's Medical Group. I am very excited to be here tonight at this Hogue live stream with you. We will be talking about a very important topic that is also very close to my heart. We will be talking about infertility and causes, risk factors, and hopefully some treatment options at the end. I will be taking questions at the end, so let's begin. So you may or may not know, but a couple weeks ago was actually National Infertility Awareness Week. And definitely we are getting more social media attention these days. And this is a great resource for all of you who are thinking about fertility or have trouble conceiving. Just wanted to let you guys know about this website called resolve.org, which is part of a nonprofit organization called National Fertility Association. So they have a lot of support groups, advocacy opportunities, a lot of education awareness. So that's a great place to start. So unfortunately, infertility affects 1 out of 8 couples worldwide, and it's often noted to be a silent condition or a silent disease. Couples going through infertility can often feel many different emotions and often a roller coaster of emotions. This could include disappointment, anger, shame, guilt, sadness, and often it's really difficult to talk to friends or family about this condition. So my goal with this presentation is to hopefully equip you with more knowledge and information so you can better protect your fertility, as well as to learn more about treatment options that are available so you can talk to your doctor in the office. So to begin, we really should focus on age. Age is probably one of the most important factors affecting a woman's fertility. And the reason behind that is due to a number of things, but predominantly a woman is born with a set number of eggs, and by puberty, half of those eggs have atrophied or degenerated. So because of this decline in the number of eggs, a woman's fertility generally peaks in her 20s, and then there's a gradual decline into her mid-30s, and then a more rapid decline into her late 30s and early 40s. Not only is there a decline in the number of eggs, but there's also a decline in the quality of the eggs as a woman gets older. And because of this decline, there's associated increased miscarriages and also increased risk of chromosome or genetic abnormalities with their pregnancies, which can lead to further loss. Besides the decline in number of eggs and quality of the eggs, there's also an overall decline in the function of the ovaries. So the ovaries are really important for releasing an egg each month, but it's also very important in generating hormones that are very important in a woman's menstrual cycle. So as a woman ages, the ovaries start to decline in their hormonal function. And the combination of all three things lead to a natural decline in the fertility of a woman. And there's no way to slow down this process or to stop this process, but we will definitely be talking about lifestyle modifications that can help better protect your fertility. As for a man, the decrease in a man's fertility seems to occur much later in life, and the reason behind that is because sperm is continuously generated, and it takes about 3 months to mature. So a man may notice a decrease in sexual function as they get older, but there's also a decrease in semen quality as a man ages, and that starts more in their late 40s and into their 50s. So when should you seek help? According to the American Society of Reproductive Medicine, for couples without any pre-existing health factors, after 12 months of unprotected regular sexual intercourse, a woman less than 35 years old should talk to their doctor. For women over the age of 35, because of this natural decline in fertility as we age, after 6 months of attempts, women should start talking to their doctors. It's really important to normalize some of this data, and most of you may be here tonight because you are planners, and When you plan for something to happen and it doesn't happen right away, it can often feel very frustrating. So it's important to know that even for the average healthy couple between the ages of 20s to 30s, it can take time to get pregnant. And the average monthly success rate of pregnancy each month for a healthy couple is 25%, meaning that 1 in 4 couples are successful in conceiving each month. By 6 months, usually 60% of couples are successful, and then by a year, 85% of couples are generally successful in conceiving. So after the year of trying, if a couple is unable to conceive successfully, that is the definition of infertility. So the definition of infertility is the inability to conceive after 1 year of unprotected sexual intercourse. It is a medical condition, and it can affect up to 12 to 15% of those who are attempting pregnancy. So when should you talk to your doctor earlier, and what are the exceptions? So if you have a history of irregular menstrual cycles, you should definitely talk to your doctor earlier. And when we talk about irregular menstrual cycles, we're counting from the first day of bleeding to the following month. So if you have regular 25 to 35-day cycles and they're very reliable, you can count them each month, then you probably have regular menstrual cycles and are ovulating. So for example, if you have a 25-day cycle and then a 26-day and then a 27-day, that's very normal. But if you're having, for example, a 25-day cycle and then a 35-day and then a 25-day again, you know, there could potentially be some problems, and you should talk to your doctor earlier about that. Other reasons to consider earlier evaluation would be if you have any history of pelvic infections, if you have any history of pelvic surgeries, if you and your partner have had any history of chemotherapy, radiation, and if your male partner have any history of male sexual dysfunction, difficulty with ejaculation, or any genetic abnormalities, you should definitely talk to your doctor earlier. So besides age, ovulation problems can often be a reason for infertility in the female partner. So ovulation refers to the when the ovary releases a mature egg each month. So ovulation is generally 6 days leading up to the day of ovulation. So how do you target your fertility window? I get asked this question a lot in the office. And so it comes down to regular menstrual cycles. So once again, it takes about 2 weeks to grow an egg and then 2 weeks to get your period. So most women will ovulate 2 weeks prior to the onset of a period. So the first day of menstrual bleed is considered day 1 of your cycle. So for a 28-day cycle, most women will ovulate around day 14. This is assuming that you have a regular menstrual cycle. So there are many applications you can download on your phone, and there's a variety of them, and they all work very well. You know, the other way you can check for ovulation would be to check your basal body temperature every morning before you get out of bed. And generally, at the time of ovulation, you will see a rise in your basal body temperature. This is a very simple way, but rather a cumbersome way of checking ovulation. But fairly reliable. Some women, if you want to dive deeper, can purchase ovulation predictor kits over the counter, and these can be purchased on Amazon or at most pharmacies. And this is a urine kit which detects a hormone called LH hormone, and this hormone generally will rise 12 to 24 hours before ovulation. So if you start tracking around, you know, day 10 of your cycle, you may be able to get a positive test. One way that your doctor may choose to check whether or not you've ovulated this month is to check a progesterone level. Generally, 7 days after the day of ovulation, your progesterone level should be high. So this is what we call luteal phase progesterone level, and this is a blood test that your doctor may be able to order for you. So generally, regular sexual activity is never a bad thing. So sex every other day has been shown to be helpful when it comes to conception. Ideally, you want to have sex prior to ovulation, and the reason behind that is because sperm can stay in the female reproductive tract for up to 5 days, but the egg, once ovulated, is only there for about 24 hours. So you do want to have sex 3 to 4 days prior to ovulation to maximize your chances. So in order to better understand the fertility treatments and causes of infertility, it's also really important to understand the process of getting pregnant. So we talk about one of your ovaries releasing a mature egg each month, and one of your fallopian tubes would have to be able to pick up the egg. The egg has to travel through the fallopian tube. Sperm has to be able to enter through the vagina into the cervix and into the uterus, where hopefully it will meet the egg within the fallopian tube. Once the egg and the sperm meets, then hopefully fertilization will occur, which will become an embryo. The embryo will then travel through the remaining parts of the tube into the uterus, where hopefully it can implant and continue to grow. So any problem within this process can lead to infertility. So what are some of the causes of infertility? Just to be kind of general here, 1/3 of infertility causes are usually due to a female factor. The other 1/3 is usually due to a male factor. And then the remaining 1/3 is usually due to a combination of female and male factors, as well as unexplained infertility. So this is a picture highlighting some of the anatomic causes of infertility within a female partner. So like we talked about, age and ovulation problems can be an issue. However, things we have to think about are their fallopian tubes open? Sometimes it could be scarred or damaged from previous pelvic surgeries. If you have a history of pelvic infections, that can sometimes cause scarring within the fallopian tubes. If you have a medical condition called endometriosis, this can create pelvic adhesions or scarring that can sometimes affect tubal function as well. Tubal factor can affect up to 35% of female infertility causes. Sometimes we may find benign growths in the uterus, like fibroid tumors or polyps, that can affect implantation, especially if these are impinging on the cavity of the uterus. So these are some of the things that your doctor may evaluate for. It's also really important to let your doctor know if you have any history of abnormal pap smears, if you've had any procedures done for those reasons, if you've had any D&Cs in the past, surgeries, because those can be causes as well. Just briefly about male factor and infertility, because 1/3 of all causes of infertility is due to a male factor. This could be due to a number of things. It could be too low sperm count or volume, and there's too few sperm to fertilize the egg. Sometimes the sperm are not shaped properly, or they don't move the correct way, so they have difficulty getting to the egg. A man may have trouble releasing sperm or making quality sperm, and these could be due to medical conditions like diabetes, men who are smokers, overweight or obese, who use recreational drugs like marijuana may have difficulty with infertility as well. There are some genetic conditions like cystic fibrosis, which can cause blockages in the reproductive tract that can keep the sperm from getting out as well. If these problems are found, usually a referral to a urologist is recommended. The purpose of this slide really is to focus on the lifestyle issues. As we talked about aging and the decline in fertility because of age and ovulation, there are some lifestyle modifications that can help better protect our fertility. So we do know that smokers generally have a decline in ovarian function faster than non-smokers. So obviously quitting smoking prior to pregnancy would also have lots of health benefits for you and the baby. And this applies to men as well. Women or men who are obese or underweight can often have problems with infertility as well. And we do know that women who are obese generally do not respond to IVF treatments, as well as women who have normal body mass index. Excessive alcohol use, more than 2 drinks a day, has been associated with decreased female fertility as well as recreational marijuana use can affect female fertility as well. It's always important to maintain a balanced diet, moderate exercise. Over-exercising and causing underweight or low BMI can often cause problems with ovulation as well. There's no diet to show that it's better for conception, but just maintaining a well-balanced diet overall. Stress can affect us in many ways, and stress has been linked to infertility, although telling a couple to relax when they're having difficulty conceiving is usually not very helpful. But there can be ways to help reduce stress, and the goal is not to eliminate all stress, but really to minimize stress in different ways possible. So I really encourage you to talk to your doctor and potentially a healthcare professional or a mental health professional that can help you in this regards. So what does your initial visit to your doctor look like? So most likely you will begin by seeing your obstetrician or gynecologist in the office, and based on the workup, he or she may refer you to a subspecialist called a reproductive endocrinologist. So these are OBGYNs who have an additional 3 years of training in an accredited fellowship program. If an abnormal semen analysis is found, your male partner may be referred to a male urologist who is specialized in male fertility as well. So the initial visit, I encourage to bring your partner if you're able to, or have him participate through FaceTime or through the phone. This definitely is a shared experience, and I encourage to go as a couple. Bring any past records. If you've had testing before, if you've had imaging done before, it would be very helpful to your doctor if you can bring any previous records. If you're a new patient, this visit may include a physical exam of the female partner. Your doctor will be asking you lots of questions regarding your medical history, surgical history, sexual history, medications, any previous pregnancies, and so be prepared to answer some of those questions. Preconception counseling is a big component of this visit as well. We do want to maximize the success of a healthy pregnancy once you do get pregnant. So the last part, I do encourage you to address any emotional or psychological stress that you could be experiencing. Your doctor is a great source of support for you, and so this is a good opportunity to bring that up as well. So your doctor may order some blood work for you after the initial visit, and one of the blood work that he or she may focus on would be blood work to test your ovarian reserve. So it's important to remember that age is still the biggest factor when it comes to a woman's fertility, but there are some blood tests that we can order to look at your ovarian reserve and see if there are any potential issues that may warrant earlier evaluation or treatment. So your doctor may order a FSH, which is a hormone level, as well as estradiol level, and often these are ordered on day 3 or 4 of your menstrual cycle. A elevated or high FSH level could be a concern for decreased ovarian function, and your doctor may order further blood testing, such as an anti-Mullerian hormone, which can be ordered at any time of your menstrual cycle. And together, these information is helpful in seeing how you may respond to treatments in the future. A very elevated FSH or a low anti-Mullerian hormone doesn't mean you have no chance of conception, but it may mean earlier evaluation and treatment. Like we talked about earlier, your doctor may order a luteal phase progesterone level to test for ovulation, and thyroid dysfunction can often be related to infertility and menstrual irregularities as well, so your doctor would probably order a thyroid hormone lab. If you have irregular periods, prolactin hormone level may also be ordered. During this visit, your doctor may also order some prenatal screening tests that can be available to you. So these are some of the blood work to expect. From an imaging standpoint, pelvic ultrasounds can be very helpful. So the goal really is to detect any abnormalities within the uterus. Are there any fibroids? Are there any benign growths like polyps within the lining of the uterus? Are there any large ovarian cysts? Your doctor can also take a look at your antral follicle count, which is when we count each egg sac in each ovary. And this can be a good predictor of your ovarian response and can also be helpful in diagnosing PCOS as well, which is polycystic ovarian syndrome. Some of the other imaging your doctor may order may include a X-ray called a hysterosalpingogram, or HSG for short. So the purpose of this test is to see if your fallopian tubes are open, and this is often a test that can be done in the office. Is the saline-infused ultrasound, and this is an ultrasound to better look at your uterine cavity to see if there are scar tissue, if there are fibroids impinging on the cavity, if there are polyps. And it also allows us to see if your tubes are open as well. So those are usually the testing for the female partner. For the male partner, this will usually involve a semen analysis, and these are usually collected at home or in a lab and then submitted to a lab. So your doctor can give you a prescription to undergo a semen analysis, and the sperm specimen is usually examined underneath a microscope to look at and see what the volume is like, what the count is like, the motility of the sperm, the appearance and shape of the sperm. If there is any abnormal findings, your doctor may ask you to repeat the semen analysis the following month, or a referral to a urologist may be warranted as well. So what are some of the treatment options? Obviously, if we find any anatomic problems during your evaluation, your doctors may talk to you about surgery. Really the goal of surgery is to normalize the uterine cavity. So this is obviously very individualized, and depending on the findings, you may or may not need to have surgery. Some of these surgeries may need to be done with a subspecialist, depending on the findings, but the goal would be to remove any large fibroids or polyps that could be affecting implantation, any large ovarian cysts that could be causing symptoms, and for male factor issues, if we find something like a varicocele, which is when there are dilated veins in the scrotum, this can be corrected through surgery as well. Having trouble moving to the next slide. Let's see here. Oh, there you go. So you may have heard of medications that can help a woman ovulate, and predominantly women who have very irregular periods or who don't ovulate regularly may benefit from these medications. And these can be oral medications like Clomid or Letrozole, or injectable hormones as well. So the purpose of these medications is to basically help a woman release one or more eggs so that statistically she can increase her chances of a successful pregnancy. And this is often timed with natural sexual intercourse or with intrauterine insemination, which is when we take the sperm sample, we wash it down, and then we put it back into the uterus with the catheter, and we time it with ovulation. So these are usually done with an infertility specialist. Injectable hormones are generally also prescribed by an infertility specialist. But you can most certainly talk to your doctor about the benefits of these medications and whether or not this is a good route for you. Assisted reproductive technology, in vitro fertilization or IVF, is probably not a new term to all of you. IVF has been around for a long time, and the purpose behind that is really to combine a sperm and an egg in a laboratory setting, fertilize the egg and sperm into an embryo, and then put the embryo back into a woman's uterus. So traditionally, in the past, IVF have been used for women who have problems with their fallopian tubes. Nowadays, it's used for a wide range of infertility issues, as well as unexplained infertility. So it does involve a number of steps. What happens is usually a woman is given daily injections of high levels of hormones for about 8 to 12 days, and the goal is to have her ovaries release as many eggs as possible. Once that happens, and through close monitoring with ultrasounds, she will go through a small office procedure under local anesthesia or conscious sedation, where the eggs are aspirated, and once the eggs are taken, it's taken into the lab where they're examined. The male partner is then asked to give a semen sample, and then the sperm and the egg are fertilized in a lab setting, and then hopefully will grow into embryos. So those pictures there, the first one just shows a mature egg and what that looks like. The second picture is showing something called intracytoplasmic injection, or ICSI, which is when the sperm is injected into the egg in the lab. And then the last picture is showing a 2-cell embryo stage. So any extra embryos can be frozen and stored for future use. Some of the benefits of IVF also include genetic testing. If a couple has a known genetic abnormality, they can choose to test for healthy embryos prior to implantation. So some of the things to consider with IVF, overall the risks of IVF procedures are very low. Some of the things that could happen include something called ovarian hyperstimulation, or OHSS. This is generally a condition where the ovaries become very enlarged from hormonal stimulation, and women can experience abdominal discomfort after the retrieval. In most cases, these will resolve on their own, but in rare circumstances, it can lead to severe hospitalization. So the other thing that could happen with ovulation induction or with IVF is the risk of multiple births. So the risk of multiple twins, triplets is about 4% with the use of oral medications like Clomid or Letrozole. It may be to some a happy thing to have multiple births, but you have to remember that there are risks and complications with twins and triplets, including premature labor, prolonged hospital stay, neonatal ICU stay, etc. So often the goal is to avoid multiple births if we can. The cost of IVF is a big issue to consider, and unfortunately only 19 states in the US are required to have an insurance mandate for any type of infertility treatments, and only 12 states are mandated to provide IVF coverage, and California is not one of them. So the cost of IVF can be an additional burden to couples who are already going through lots of physical and emotional stress. So definitely check with your insurance ahead of time if you're thinking you may need to go that route. And there are often some coverage plans that can be available through your employers. How do you pick an IVF center? So the most important thing I believe would be to talk to your OBGYN. And they may know someone they trust and they've worked with for many years. So that would be a first place to start. SART is the Society of Assisted Reproductive Technology, and this is a nonprofit organization that receives data from certified IVF centers regarding their success rates, their birth rates, pregnancy rates. So starting with SART.org can be very helpful. And it also has a lot of resources available for patients as well. Resolve, we talked about earlier, that's a great website for patients as well as professionals. It's really important to remember that overall infertility treatments are individualized, and it depends on many different factors, including your age, your blood test, your ovarian reserve, your lifestyle factors, and it's really important to talk to your doctor or your subspecialist regarding your prognosis. So in summary, I want to kind of summarize by saying that, talking to your doctor early is never a bad idea. If you have any concerns, make an appointment for preconception counseling. go with your partner. This is a good time to seek mental health support, and the best person to talk to would be your doctor. Know that you're not alone. Most couples who begin to explore the medical options available for infertility treatments will often find hope. I'm happy to answer any questions at this point, and hopefully we'll see you in the office as well. So, okay, let's see here. So the first question I have here, what are some steps to take if we can easily get pregnant but lose the pregnancy around week 6 to 7? This was the case for the last 5 pregnancies. Well, I'm very sorry to hear that. That must be very sad and frustrating. There can be many reasons for recurrent pregnancy loss. If you haven't talked to a doctor about this, I would really encourage you to do so, because there are specific testing that we can do to look for any causes of recurrent pregnancy loss. If you haven't had any imaging, any blood work, sometimes we could look at autoimmune conditions or other medical conditions that could be related to recurrent pregnancy loss. So there's no straightforward answer to this question, unfortunately, but I would really encourage you to make an appointment in the office, either with your OBGYN or with a subspecialist like an infertility specialist. So this next question says, I have been tested for every infertility cause. Nothing has shown up. I can easily get pregnant, but lost 3 pregnancies at 6 to 10 weeks. Should my husband still get a sperm test? If you have been tested for infertility, I am guessing you're potentially working with an infertility doctor. If not, this may be a good reason to consult with a reproductive endocrinologist. There are some very specific semen testing that can be done that I'm not equipped to talk about, since I'm not a subspecialist. But based on kind of what I'm seeing here, you know, it may not just be a semen test that would be helpful, but really looking at reasons why you had a miscarriage between 6 to 10 weeks. So recurrent first trimester losses, similar to the last question, should be further evaluated. So this is a pretty popular question that I get in the office, and the question is, will freezing my eggs when I'm younger guarantee a baby later when I'm older? So egg freezing and egg banking at an earlier age is definitely becoming increasingly popular and offered by a lot of companies and employers even. So the benefit of banking your eggs earlier is that you are storing your eggs when you are younger. And as we talked about age and fertility being closely correlated, the younger you are when you bank your eggs, theoretically the better quality the eggs are. We do know that egg banking can be helpful, although there's no guarantee that when we want to use the eggs, that they can fertilize into healthy embryos. So that is something to talk to the IVF center that you're thinking about banking your eggs with. Some women will choose to bank embryos versus eggs if they have a partner, or some people would choose to use donor sperm. So this is not a straightforward question or answer, but there is no guarantee that you can have a healthy pregnancy just by banking your eggs alone. Do insurance plans cover infertility treatments? You know, like we talked about earlier, only 12 states in the U.S. have an insurance mandate for qualified employers to provide IVF treatment specifically. So that is a huge part of the advocacy, you know, nationwide, is that, you know, maybe we should have more insurance mandate so that couples can have better insurance coverage for infertility treatment. So you can start by talking to your companies. If you're interested in local advocacy, resolve.org is a great place to start. This question asks, if I'm going through treatment and I think I'm pregnant, how long do I wait before seeing an OBGYN? So if you're going treatment, are you referring to infertility treatments? Often a couple will see an infertility specialist up to 10 to 12 weeks of the pregnancy, and then they are transferred to their regular OBGYN who would be taking care of them for the rest of the pregnancy. If you are trying on your own and you have a positive test at home, we generally will see our patients around 7 weeks in the office for a pregnancy confirmation visit. If you're not sure, you can always reach out to us and we can guide you along the way. The other question here, how many times should I try IUI before moving on to IVF? So that is definitely an individualized question. A lot of insurance coverages or couples may choose to do an intrauterine insemination about 3 times before they proceed to other types of treatments, but that's definitely not a one size fits all. So if you are doing IUI, I would encourage you to talk to your IVF doctor or your infertility specialist because depending on the reasons of infertility, that could differ. What is the success rate of IVF? There's no one number that is quoted for everybody. So this is definitely very individualized and can be based on a number of factors, how old you are, if you have any lifestyle factors like obesity or that could affect IVF, and also based on your blood work testing, your ovarian reserve testing, it can vary as well. So IVF centers will usually publish their IVF success rates, but it's important to remember that depending on the type of patient population they have and the type of cases they have, this can differ widely between different centers. Should both my partner and I be evaluated for infertility? Well, definitely if there are concerns and you have been trying for a year and you're under 35 years old, I would definitely recommend that both you and your partner be tested, but definitely start with a visit to the office first and talk to your doctor about any problems that you are concerned about. Okay, I think I have a couple more. All right. So how does the thyroid issue affect infertility? Does it affect one's ovarian reserve? If thyroid issue is resolved, is it still possible to get pregnant? So thyroid dysfunction can most certainly affect a woman's menstrual cycle, and hypo or hyperthyroidism can cause changes to ovulation. So usually part of the basic blood work for infertility testing include thyroid hormone testing. If the thyroid issues are resolved and that was the only problem, it is possible to get pregnant. Well, this question is great because it also mentions a very helpful book. So according to It Starts With the Egg book, DHEA is recommended for diminished ovarian reserve, age-related infertility. Is it safe to take to boost the number and or quality of eggs for IVF? So It Starts With the Egg is a very helpful book, and I encourage you to explore that book when you have time. This is a very specific question I believe would be better suited for an infertility specialist. DHEA is often part of routine protocols when it comes to IVF treatments, but from what I understand, it is individualized. So I think that's all the questions I have tonight. It's been very fun to be here with you, and I do work out of the Irvine and Laguna Hills office, and I'm happy to see you in the office and talk more about your specific questions. So I appreciate your time tonight, and I'll talk to you later. Thank you.